The Vice Chancellor, University of Medical Science, Ondo State, and Chairman, Anglican Compassion and Development Initiative, ACADI, Professor Adeshegun Fatusi, has advised the Church to keep collaborating with educational institutions and other development agencies in order to achieve her goals in developing the health sector. He made this known in an interview with ACNN News crew in Abuja at the recently concluded maiden edition of the Church of Nigeria Anglican Communion Health Summit held at St. Matthew's House, Gudu, Abuja, with the theme, Health Prosperity in the Decade of God's Reign, taken from the book of 3 John chapter 2, and the sub-theme, the Church of Nigeria and the Universal Health Coverage.
One of the strengths of the church is that the church has people everywhere. The church has all the experts, and the church has all the linkages. What we need to do is to reach out to schools. We should become a convening point. We should convene like critical stakeholders within those sectors, share our ideas, share our plans, and then extend the hand of fellowship. And I think we have examples what ACADI is doing. ACADI already, for example, is partnering with schools in the drug prevention program we are doing. We are already working with secondary schools. And all we did is we started with the secondary schools that belong to the church and belong to the Christian network. And we've moved from there to start working with those in government sector. So the schools are also willing to work with us because they know we are credible, they know we have a message, they know we have commitment. So they are also looking for that kind of opportunity. What we need to do is we need to just step out and let them know we are available and we are willing. You know, one of the things we are facing as a problem in the country when it comes to health professionals is the issue of a lot of immigration. But on the other hand, we also have one issues sometimes in terms of policy, in terms of performance. So one of the things the church has as a strength is its moral strength, the values it holds, its orientation around quality and commitment. And I think what we need to do, like the Bible tells us, we are the salt of the world. Salt is useless on its own. It only has value when it gets contact with other materials to preserve it, to sweeten it. And that's what we need to do when it comes to quality assurance. Number one, we need to start with ourselves to set clear standards. What are the standards by which we live and we work, particularly talking about the health sector? For all our facilities, what are the standards that they should live up to? How do we monitor the standard? How do we improve performance? Because you can't give what you don't have. When we have set that standard, then we can begin to share with other people and invite them to a sharing session or learning session to see, this is how we've done it. This is how it can be done. And that way, our people can also be educated and carry that same value to the various hospitals they are working. And also importantly, we must become advocates. We cannot be distant from society. We must be in the society and infuse ourselves. So the church also needs to begin to speak about those values that matters when it comes to hospital performance, health worker performance, and the standards that we expect to hold government to and accountability issues within the country. The church cannot do it all, and that's where partnership with organizations become important. We've always looked inward at our members, but a lot of organizations that are funding organizations that are looking for people they can support who have values. Because when you talk to development agencies, what they talk on is not what you say, is what they want to see is your proposal. What do you aim to do? How do you aim to do it? What are the goals you want to achieve? And when they see the value in it, it's easier for them to support us. So we need to develop formal proposals, technical, high-quality proposals that respond to the issues that our country is facing. And again, let me give an ACADI example. ACADI has funding, for example, from Ford Foundation. It didn't come by accident. It's because the whole process about developing proposals, submitting it, defending it, and going through all that whole process is something ACADI was able to do. Looking for people who share our value, people who respect what we respect. Of course, we are not going to compromise our value because we want money. So it's important that we do those things in a very standardized way. And that way we can get the support we need.
Professor Fatusi, while speaking on the theme of the maiden edition of the Church of Nigeria Health Summit, said it is apt, adding that serving God can only become easy when there is a good health.
The theme of the summit is a very apt one. when you are thinking about health prosperity in the decade of God's reign. Because without health, there's nothing you can do. Serving God will even be difficult. And the Bible tells us about the premium of health. So this is extremely important, particularly because it's meant to galvanize action in a particular framework of time so that we can see results and we can see changes, starting with our church and to our communities and our nation.